and it doesn't exactly provide a good path forward. The treatment typically in the medical realm, at least from what I've gathered of my patients who have had it, is they do high-dose antibiotics for however long it takes for it to quit showing up on
Yeah.
testing, at least on a culture, things like that. And then from there, they don't do anything else, but they have all these downstream symptoms. So why is it so difficult to treat? And this spiral or spirochete form is a big part of the reason why that is. So essentially, it's like this corkscrew, like spring type shape. And because of that, what it can do is it can kind of get into all kinds of nooks and crannies in the body. It's very, very mobile, and it can actually penetrate into your tissues, into your cells, all that stuff. And so it can actually evade it can evade antibiotics, it can evade herbs. And in addition to that, it doesn't just evade stuff, and it's not just super mobile, but it also secretes biofilms, which we'll get into in a little while, which essentially are these mucosal protective, barriers that it'll kind of house itself in, keep all sorts of herbs and antibiotics and things like that away from it, so it doesn't kill it off. And so there's special things you have to do to combat that. So anyway, it can be difficult to treat. So that's a big part of the reason why. But Dr. Joel, do you want to jump into different strains, you know, all that stuff that we've got here on
Yeah.
the note?